Men and prostate cancer. Let's talk about this and try to save some lives. It's the most commonly diagnosed cancer in men. To help us do that is my guest, Dr. Michael Liepman, Associate Professor of Urology at the Yale School of Medicine. Welcome.
Thank you so much for having me.
All right, let's get down to it, shall we?
Okay.
Okay, how common is prostate cancer in men, and at what age are we seeing it?
Yeah, and it's such an important question. It's the most commonly diagnosed cancer in men. We estimate that about 300,000 men are going to be diagnosed in 2025.
That's a lot.
It's a lot, yeah. And so about 1 in 7 men are expected to be diagnosed in their lifetime.
Age?
The average age in the U.S. is 65 when people are diagnosed. And we know it's more common as people get older.
All right, so this is usually picked up by your primary, right?
That's right.
Why don't men go to the doctor so that they don't have to see you?
It's an age-old question. I think, guys, we tend to be a little bit less proactive about our health. There's a bit of a stigma, too, about prostate cancer because the prostate is part of the reproductive system. So I think some guys are just putting that off or dreading it because they're worried it might involve a rectal examination, which I might have some good news for you that in some cases I think we can be, if that's a barrier to screening, I think there's more evidence that we can skip that and use some additional testing like imaging to help do that examination.
So that would be music to some guys' ears.
Yeah, so guys, listen up, that's an option. The real workhorse of screening is this PSA test. It's a blood test that can be done as part of your routine annual physical. And what PSA is, it's a protein made by the prostate. And the higher that level is, it can be an indicator of potential prostate cancer risk.
What is the Gleason score in layman's terms?
Okay. So if someone has an abnormal PSA level or we're concerned they could have prostate cancer, we do a biopsy where we take a little piece of the prostate and look at it under the microscope. So that's when the Gleason score comes in. If the pathology doctor, if the expert looks at it and says they're cancer cells, the Gleason score is a summary of what those cancer cells look like. And it goes on a scale from 1 being the least aggressive to 5 the most aggressive. And so so in layman's terms, it's kind of a measure of how aggressive the cancer is.
Are there symptoms with prostate cancer?
There can be at advanced stage. So if prostate cancer spreads beyond the prostate to the bones or lymph nodes, it can cause pain, it can cause blood in the urine. But the good news is if we catch it early due to PSA testing, it's usually not symptomatic.
Let's talk about some of the new treatments.
Yep. Okay, there's a lot of reasons to be optimistic. Every year when I kind of have these conversations, we're making progress in how we treat prostate cancer. So for people who are diagnosed at the early stage, when it's still confined to the prostate, there's a range of options, from surgery to remove the prostate, advancements in radiation treatment, as well as ablation treatments where we zap or give energy to a region of the prostate but not the whole thing. The overall direction is that the treatments are less invasive, people are living normal lives with less side effects, and moving on from it.
How many patients do you see a year that they're in big trouble?
We see too many people who show up to me by the time the cancer has spread. And that is something that we can really make a lot of progress in. And I think that screening is the easiest thing we can do. It's low tech. We're not talking about a new innovation, a new drug, or anything like that. PSA is a blood test. It's been around for 30, 40 years. People's doctors can order it for them. And I'm not sure we're going to remove all of those cases, but we can make a lot of difference.
What's a sentence you can say to a guy to get him to a yearly checkup? Think about his family. What can you tell him?
Yeah, well, we're here for you. I mean, I think that's it, is that we do this a lot. We want to get you back to your quality of life. This is not saying goodbye to a chapter of your life. People are worried about an impact on their urinary function or their sexual function. So we're here for you. We do this. Lots of men have gone through this before you, and you know, we can get you through it.
Well said. Okay, pay attention. Go to the doctor. For more on prostate cancer and the Gleason score, go to WTNH.com or the News 8 app.